Hello, we are Group 4,
Hello, hello.
and our position is legalization of drugs leads to more problems, and also addiction is not a disease. We decided that legalization of drugs will increase their usage, which will then create more addicts. So from there, the cost of addiction treatment is going to cause society more costs, which is then going to raise taxes, and more individuals trying drugs because they're readily available is also going to become a problem. Um, Legalization of drugs is going to cause the exploitation of more harder extreme drugs, which will then, cause more overdose on drugs, and actually more HIV cases, could come about because of the sharing of needles. Legalization of drugs will then, we'll have to show TV ads, which our children are going to be, exposed to, which is going to cause them to experiment with drugs, which can lead to more overdose and parents, not being able to, keep their children. And based off the psychological study of the BOGO doll, it does show that children mimic behaviors, that they are exposed to by adults. So once children see that, hey, we have these drugs, they're on TV, it's nice, they're going to want to, try it out, see what it's like. And, in a sense, that's going to just be more accidental intake of drugs in our minors, and we don't need that.
And we see it with alcohol as well because, alcohol commercials are always, dazzling, and they have the most beautiful people and actresses and actors in it. And it makes alcohol seem like something fun. And that's why you see a lot of cases of underage drinking. I believe Georgia just passed a law where if you're not 21, you can't step into a bar. They're confiscating, fake IDs left and right, especially like Savannah. I know I went down there not too long ago, and they just stacking up fake IDs left and right to go into bars. So it's the persona that these, not just alcohol, but drugs will do if we legalize it, because then it's something to advertise in the, anything to advertise. Yeah, they're always going to make it something big, like, like Christmas or Valentine's Day, something big. So they're going to do it big.
Our second point was addiction is not a disease.
Mm-hmm. So what is addiction? Addiction is the loss of control in forming a strong dependent on a substance, right? So addiction is a choice. It's voluntary initially, actually. And you might ask yourself, what's the difference between addiction and disease? But disease is a malignant disorder that affects the body in a specific way. It's involuntary, which is the key, and it cannot be helped, whether it be from genetics or from a regular sickness. So I know you're thinking, well, they both affect the body in different ways, blah, blah, blah. They can both be malignant and pretty fatal and sometimes violent, right? But the key is that they're different because addiction happens through the actions of one's own free will. It developed from a choice, and disease is not a choice.
Yeah, I would say that, addiction should be thought of as, a voluntary behavior, because you decided, you knew the consequences. If you didn't know originally, someone at some point in time told you, hey, let's not use these drugs. And you decided, yeah, I just have to have it.
And you see the, effects of that, like, if you're, shooting up crack and stuff, you see the crackheads out on the street. So you know what you can become. You see the mirror of what you can become, but you chose to take that road, and these are the consequences for your actions.
Mm-hmm. Right, and if you chose that with it being legal, because right now crack is legal, and you see crackheads, if you choose to do crack, you already knew what was the outcome. You saw this, which is why we don't need to have it legalized, because when it's not legal, we still end up with, crackheads. Yeah. Where did they come from? They didn't just, they weren't born crackheads. They became that way because of a choice.
Yeah. And the more, if it's legalized, because there's some people that's not even exposed to it.
Right.
So, and if it's legalized, more people are going to see it. Subconsciously, they're going to know about it, and you never know whatever may happen, in their lives. They may want to convert to doing crack cocaine.
Right, but
Because-
see, that was a choice. That's why
Right.
addiction is not a disease. They
Exactly.
chose
It's
to, use
The
the
exposure.
drugs.
I think that I honestly think that if drugs and cocaine is legalized and all these things that we're talking about now, more people are going to be exposed to it. It's a numbers game. So the more people exposed to it, the more that you're going to have people that are going to be willing or even tempted to do the drug.
Yep. And the
So-
sad part about it is if we're allowing it to be legalized and, we're making it seem like, we're saying addiction is not a disease because, you're taking that choice and we're making it legalized. People are going to start, thinking it's a common thing.
Mhm.
Oh, it's common to be a
Yeah,
crackhead.
why not?
It's common to be a dope fiend.
Mhm.
It's common just to sit back. Now in our society now, our biggest thing, like we've said in class, is marijuana, and it's common. Hey, it's
Mhm.
common for y'all to kick back and smoke, what?
Mhm.
But if we just keep legalizing everything, it's going to be a common thing. You hear a bunch of people say, "My uncle really is an alcoholic."
Mhm.
It's common. We don't want drugs to become a commonplace in our society.
Yeah, exactly.
Because then we have to worry about the ways that we're going to treat it. What are the most effective ways, for treating an addiction, would y'all say?
I think the most effective way for treating an addiction, I think, is behavioral therapy. Excuse me.
Yeah, I definitely agree.
I believe that if you're able to sit and talk about what's going on with you, you'll find that usually people with addictions have a deeper problem within themselves.
Mhm.
Like we said, most of the time people don't just wake up and say, "I want to be a crackhead." Most people don't say, "I just want to,"
Be an alcoholic.
be an alcoholic. People aren't
Yeah.
just saying that, today I'm just gonna wake up and shoot a little heroin up.
Yeah, exactly.
Oh, man, thank you. Woo! It's more of a deeper meaning. A lot of times it's family problems. Like we read in the book, it's like, you see a lot of different things in the household, like domestic abuse
Mhm.
leads to certain stuff sometimes. It's a big factor in it. You see people who are doing different things. I mean, the family, a lot of times your family is what pushes you to do these things, or something traumatic. Like, people are very attached to people. So, some people might lose their grandparents, or somebody
Yeah.
lose something very, very close to them. It makes them want to see, like, I need a way out. And
So in a sense, harm reduction is going to be one of the, most effective things because
Right.
the behavioral therapist is going to let you know, hey,
right,
this is what is going to happen. This is where you're leading. It's
Right.
going to be up to the individual to say, yes, I'm ready to make this change. I'm ready to get off these drugs and I'm ready to change. So,
right.
that just goes back to the fact of addiction not being a disease because it is a choice.
Right,
Exactly.
and we can be able to see the effect. You see what's going on. You see better people for that. We even see it in like when people are incarcerated. Sometimes they don't want treatment, but sometimes treatment doesn't have to be voluntary all the time. And
Exactly.
them talking through their problems, a lot of times, either they're gonna go right back or they're gonna come back and say, I don't want this anymore because I have a family or I have things to do. And it's the medicine wise of it is nothing to say I have to have something to substitute this
Mhm.
for that with behavioral treatment. So
Now, speaking of, now we were talking about the most effective. Now, the least effective way, and before, I thought it was basically cold turkey. When a lot of people, because before I always thought that cold turkey was a bad thing.
Make you sick, and that's what they tell you. That's what
exactly.
they expose you to.
Really
And
bad
now,
withdrawals.
exactly. Now that's bad for a lot of people. But what I really, what I paid attention to now, I really think that medication, when it comes to the least effective. And
Right.
the reason why I say that is because of human error. When it comes to, like, say for instance, I had a cousin who smoked cigarettes. She smoked cigarettes for like 20 something years. And she wanted to stop, so she went to the doctor and she got some gum. She got the nicotine gum. And at first it was kind of helping her a little bit, but the thing was she wasn't having that person that was constantly talking to her. Because
Right.
if she didn't chew the gum, if she left the gum at the house like a couple of times she did, if she was around her friends on break, she was
Relapse.
smoking
If we
cigarettes.
legalize these drugs,
Exactly,
relax.
exactly.
With the medication, it's in a sense like, why would you offer someone whose brain is vulnerable to chemicals already
Mhm.
some more medication for them to become addicted to that. So what you don't want is to make them become, addicted to this medication. What's going to happen once they're addicted to this medication? Because the brain is vulnerable. So I do agree that the medication is going to be the least effective.
And then we want to talk about this too, because we want to, look at the overall health of the person,
Right.
the patient as well. And, a lot of these medications, for withdrawals, and a lot of these medications for people that's trying, they have side effects, and that's one thing that I think, I know in some cases that you should put a person on medication, but I really think, there's more effective ways
Yeah.
than medication. So
Yeah, I think that is definitely going to be the least effective way. And that concludes our segment on legalizing drugs. Do not legalize drugs. And addiction is a choice.
thank you.